He's been in private practice since 1996. He has a homeopathic pain and sports medicine clinic in Paradise Valley, Arizona. He is an international speaker and acclaimed author of Hypothyroidism Type 2, The Epidemic. Please give a warm welcome to Dr. Starr.
Can you hear me? All right. Now let me turn my phone off. I was texting I asked Dr. Fisher if I could talk about my group that I'm in. There are only 2 states in America that allow holistic medicine, and those are Arizona and Nevada. We have homeopathic MD boards that allow holistic medicine. It's the Arizona Homeopathic and Integrated Medical Association. And I was just texting the secretary to make sure I get her email right so I can tell everybody, because we're a very small group, and wonderful homeopathic doctors and integrated medicine doctors, which is what I would describe myself. As a matter of fact, I just changed my name to the Scottsdale Holistic Rejuvenation Center because I haven't had much luck with sports injuries, despite being board certified in pain and having studied with President Kennedy's last pain specialist. His name was Hans Krauss. He worked with 2 endocrinologists because he knew that hormones and pain were one and the same. That's how he got to treat President Kennedy. Kennedy had Addison's and low thyroid. And so Gene Cohen was President Kennedy's endocrinologist, and Larry Sonkin was the other endocrinologist that Dr. Krauss worked with. Dr. Krauss wrote the book Diagnosis and Treatment of Muscle Pain. He treated President Kennedy's back pain, got rid of his chronic back pain, despite the fact he'd had 3 failed back surgeries. Dr. Krauss wrote the book Sports Injuries. He was an Olympic ski doctor for decades and treated Eleanor Roosevelt, Bobby Kennedy, JFK, Jonas Salk, among a whole host of others. He invented the wise way to a healthy back. Over 80% of the patients who had chronic back pain for at least 1 year, 80% of them resolved just doing his exercises. He also felt that he could obviate the need for 80% of orthopedic surgeries with using these big needles that he used on me, and I've been using on my patients for some time. Unfortunately, exercise isn't much money, so that hasn't been promoted, doesn't produce much money, and neither did the trigger points. So when I had my pain clinic in Missouri, where I'm from, I went to the University of Missouri, and after my residency in physical medicine and rehabilitation, I also was board certified in pain. And so anyway, I had chronic back pain. I had a fractured low back, and playing high school football. 25 years later, I hooked up with one of Dr. Krauss's proteges, Andy Fisher, who was chairman of the physical medicine rehab department at the Bronx Veterans Hospital. I saw him lecture, and he let me come study with him. I was going to stay there for 6 weeks. I ended up staying 2 years in New York. And when I told Dr. Krauss my symptoms, because I thought I was low thyroid, I had a bad motorcycle accident too, and basically took my 20s off. So I was 37 when I finished medical school. I was 40 when I started having a lot of thyroid symptoms. I got cold easily, dry skin, constipation, lowered mentation, basically, brain fog, and so on and so forth. But nobody would treat me because my blood tests were normal at the University of Missouri. So I was a physical medicine and pain doctor. I didn't know about thyroid. But Dr. Sonkin treated me the first time he saw me and said, "Mark, I've been treating this same patients for the last 50 years, and these new blood tests that were mandated in 1970 was when the TSH came into vogue. These blood tests are missing millions of people, and you're one of them." So that was quite an eye-opener. So when I went back and opened up my pain clinic after 2 years in New York, it took me about 2 years to realize that almost all my pain patients had the same thing I did, which was low thyroid. And I never, ever, intended to be an endocrinologist or a thyroid doctor, but none of the other doctors would treat my patients because most of them had normal thyroid blood tests. So I got elected by default. And it didn't matter how well the patients did. I was not treating standard of care. So to this day, I'll tell you, but basically I've lectured all over the planet thanks to my book. And in all the Western civilizations, the medical doctors are brainwashed the fact that these blood tests work quite well. And if you do not treat the blood tests, including Sweden and Canada and basically Great Britain and everywhere else you can think of, they yank your license. The number one cause of losing your license these days in America is for treating thyroid patients like I recommend. So I'm going to show you why. So I published a book a year ago called Heart Attacks, Heart Failure, and Diabetes, and said we've known how to prevent all this stuff for 45 years because I decided to go through the whole history of low thyroid and how it was treated initially and what happened and what went wrong. And I can tell you what went wrong was that Big Pharma, the insurance companies, the AMA, and all the powers that be don't like people getting well using thyroid. So I'm going to give you the evidence of that. So anyway, I texted my secretary, we have to cost us at least $60,000 or more to stay in business. We have a full-time lobbyist because we have to keep our finger in the dike at the Arizona State Legislature. And we also have a full-time secretary. And the homeopathic doctors aren't very many of us. They're probably around 100, if that. And homeopathy is not a lucrative vocation either because you just make remedies and you don't have expensive treatments. So anyway, anybody who cares to help our group or join our group, if you want to treat like I do, you have to practice either in Nevada, where Dr. Schallenberg is the other state that he's able to have a homeopathic license and treat holistic medicine, or Arizona. So people like Jerry Tennant and Dr. Ray, the #1 environmental medicine doctor, and Dr. Tennant's a genius, and I'm going to talk about him if I have time, but they all have homeopathic MD licenses in Arizona in case anybody wishes to go after them. So I'm sorry about any negativity, but this is really positive because we know how to prevent heart attacks, heart failure, diabetes, and I just got the clinching evidence just recently that I think I can basically convince you beyond a reasonable doubt that we also have the same information to prevent Alzheimer's and dementia. So I'm going to go over those things. I made the talk kind of superfluous, the Disastrous Consequences, because I didn't want anybody to stop me from giving this lecture, like, how to prevent heart attacks, heart failure, diabetes, and Alzheimer's. And it's all the same thing. It's all thyroid and bioidentical hormones. So here we go. So you can look up all of my stuff. So myxedema. Myxedema is the medical term for hypothyroidism. Mix is mucin, which is a constituent of all of our connective tissues, but it accumulates in abnormal amounts when you're low thyroid, and about half of the people who are low thyroid. The other half don't have myxedema. You can be skinny as a rail, you can be obese, and everything in between. So I'm going to show you a little bit about myxedema because I would bet most of the dentists haven't studied as much as I on the subject. So it's a firm type of swelling, the mucin. About half the people have it. So I found one of the textbooks. I spent 5.5 years looking through library storage. And I'm going to tell you all about that and some of these old pictures. So myxedema is thyroprival, pertaining or characterized by hypothyroidism, and pathognomonic, specifically distinctive and diagnostic. So here we go. Let's. The first big report on myxedema was 1888 by the Clinical Society of London. That's referenced here. And I took this, it was a 200-page document. They didn't know how to treat it yet, and they had 60 autopsy studies and a number of the symptomatology. They were doing autopsies on everybody back in 1888. And I love this quote: "The general uniformity of the more prominent symptoms is indeed remarkable, allowing ready recognition of the malady in any freshly encountered case by an observer who has seen one well-pronounced case." So here we go with the pictures. This was the 1888 report. So let me get my laser pointer. And so they didn't give ages on this case. So before myxedema, looks pretty healthy. And then years later, no ages given. So the other diagram they had was before myxedema, age 21. So she's perfectly healthy, it looks like, on this picture. They called this mild myxedema. Often the myxedema starts to accumulate on the jaw lines, the eyes get puffy, the hair is not so nice. The thyroid controls the integument, by the way, the hair, teeth, and nails, which will help my rejuvenation clinic quite a bit. And let's see. So, and then marked myxedema. So profound. So basically you should recognize anybody who looks like this as being low thyroid. So by the early 1900s, the first cure was 1891. Glandular thyroid, pig, beef, and sheep. Dr. Hertog, you all may have heard, especially the integrated medical doctors, have been 4 generations of one family before they were even called endocrinologists that had been endocrinologists, and it's Terry Hertog and his sister Therese, who are the 4th generation. So this is their great-grandfather's picture, and this is the practitioner, a wonderful article from 1915. So you can see, so frontal balding is one of the symptoms. The hair is not so good. This is after treatment. You can see quite a change. This fellow was not on a diet. And you can see how profound the patients can recover. Profoundly they can recover. The woman, same thing. Even the ears get puffy, the hands puffy. You can see quite a change when they treated her properly with desiccated pig thyroid. Here we go some more. So it just goes on. I think a picture is worth 1,000 words. So unfortunately, I had one patient who weighed 400 pounds. The poor lady had arms this big. They were hard as a rock. She'd been to a whole bunch of endocrinologists. They told her she needed to lose weight and stop eating so much and take antidepressants, which is quite common. And so the endocrinologist and the primary care doctors have no idea what myxedema looks like. This was one of my patients. Yes, it still works. It's hard to get people to volunteer their mugs on my presentations and books, but I do have a couple pictures. So he was 23 years old, fatigue, paranoia. He developed after he got all his vaccinations when he joined the Army, and anxiety, brain fog, inability to lose weight. I got him up to 3 to 3.5 grains, which happens to be the adult dosages you need in order to reverse all this stuff. So the last picture I'm going to show right now is myself. So this is before I started to be treated. The neck starts becoming puffy. I was symptomatic. You can see there's pretty much difference in my appearance as well after I was treated properly. That's probably 10 or 20 years later. So I'm 62 now, and I feel better than ever, even though I'm getting a little bit of wrinkles. I lift weights and I'm gaining more and more stuff. I'm gaining more and more strength, I mean. So this is myxedema. You can see how puffy the hand is, and it's firm type of swelling. This was another gentleman who had the same problem, and I treated him. His doctor had told him he was, the reason he had the puffy skin was because he was obese. He had a big pannus, and he was one of my poker buddies, and he had high blood pressure, irregular heartbeat, fatigue, chronic pain, and he chose to let me treat him, and he's still alive. And I wasn't the most popular fellow in Columbia, Missouri after a while, because I told him to tell his primary care doctor that his skin had gone on a crash diet because because it was gone, and he still was fat anyway. So this is what a baby looks like. The big babies are hypothyroid, anything over 8.08 pounds. I've got some endocrinology textbooks in this lecture. So the symptoms of children. So this little guy had myxedema. That's what myxedema is. This, by the way, was the last textbook. Dr. Lisser was chairman of or president of the American Endocrine Society. He and Dr. Escamilla worked at the University of California, San Francisco in the endocrinology department their entire careers. They were the last ones who treated or who published a book I could find with before treatment and after treatment pictures. And that was 1957. So since that time, there have no before treatment, or have not been any before treatment or after treatment pictures in any medical textbook that I could find. So I'm going to quickly go over some of the dental stuff before I get into the 4 major diseases I think we can reverse and stop. So diminished immunity is one of the hallmarks of low thyroid, poor circulation. This is a quote from the 1888 report. Their teeth usually suffer in all their nutrition, break off, fall, or become carious. The gums are often swollen, spongy, and bleeding, and occasionally receding. So other things I've noticed are crowded teeth, overdeveloped gums that project downward between the teeth. Opposite can happen. You can have big gaps. I had a big gap here, and it's cosmetically improved. So I think that's low thyroid. TMJ I broke 2 of my lower molars because I had teeth clenching. Harold Gelb, my teacher, Larry Sonkin, wrote a chapter with the famous old Dr. Gelb, and that's referenced as well. And once I had enough thyroid, I didn't clench my teeth anymore. 25% of my patients with chronic pain had TMJ, and most of them resolved. So Dr. Krauss did trigger point injections. He worked with the endocrinologists. They worked with psychologists, treating the dysfunctional muscles. So they must have had a heck of a good TMJ clinic. So I'm sure the dentist wouldn't be able to treat, and neither could the doctors without getting in trouble these days the way they treated. So this is a child that has myxedema. Once again, Dr. Lisser and Escamilla. I'm going to put my first readers I've had since I got to be over 60. Okay, so let's see. The child was 9 months of age. They called it a saddle nose. The sphenoid bone does not grow properly, so you have a kind of a flattening here in the nose. So Dr. Lisser and Escamilla called it a saddle nose. The lips were puffy, thick protruding tongue, 9 pounds at birth, 4.1 kilograms. No teeth had erupted. Open posterior fontanelle. Rectal temperature was 96.4, which is 35.8 Celsius. And I'll tell you a little bit about basal temperature later. The basal metabolism is what they did to treat the low thyroid, to test for low thyroid the first 50 years after they had a test, because the thyroid controls the speed and efficiency at which each and every one of our cells operate. So it controls your metabolism. And without having really good metabolism, your health suffers no matter what you exercise or what you eat. So this child's had a basal metabolism of 45% below normal. It was unable to sit up after 5.5 months of thyroid, giving 1/3 of a grain, increased to 3/4 of a grain, loss of puffiness and elevated bridge of the nose. Basically, the sphenoid is now developing. After 21 months, 7 more months, the mouth closed. She grew 10 inches and had 16 teeth. And she also had, oh shucks, an umbilical hernia, which is also a symptom of low thyroid. And guess what? By giving the thyroid, the umbilical hernia resolved. So my niece had hers surgically treated. And yes, she is low thyroid. Okay. So yes, it affects every aspect of your well-being. Oops, wrong way, Jose. Okay, so I'm not going to go over all this stuff. It's in the lecture. You can read it later. I want to get through this. You can tell I talk too much because I haven't really gotten anything close to heart attacks, heart failure, diabetes, and dementia yet. But I thought I'd give the dentists, some time. So you'll have to look through. So this, the children who have growth deficiency, like my parents took me to the endocrinologist when I was 14 because I stopped growing. They said my blood tests were normal, and growth hormone in 1967 was not yet in vogue, and I was tall enough. So this little girl grew, she was 7 years old, 2 feet 11 inches, severe constipation. After 8 months of treatment, she grew 8 inches. The stomach was receding, the neck is elongating. This girl was 14. She had the saddle nose, thick lips, heavy menses, severe constipation, poor appetite. After 6 months, the ridge of the nose elevated, thinner lips, brighter eyes, curly hair, no constipation, appetites improved. You can see that the thyroid hormones and the other hormones, as I will explain later, are the most powerful medicine you can give anyone, anywhere, anytime. If they need it, of course. So this little fellow was diagnosed with autism. The panda doctor had made the diagnosis. He was not social, had all sorts of GI problems, recurrent upper respiratory infections, yeast, kind of puffy skin, dry skin, rashes. I gave him a little iodine and some thyroid, treated his GI tract, detoxified him. I've got PD6s in my books, at least my big book, the first book I wrote, procaine, DMSO, rosemary, parsley, oregano oils, hydrogen peroxide, a couple other things, homeopathic to take out mercury. So I detoxified them. These kids are toxic. They don't detoxify very well. So after 3 months of treatment, you can see he's looking a lot better. After 10 months of treatment, the special needs doctor, the panda doctor, said he was no longer autistic and ineligible for the panda program. Now he was diagnosed with ADHD. Bridge of the nose is developing. He's playing interactive games, telling his mother his likes and dislikes, very smart. Stimming persisted. He wasn't quite as coordinated. So it took him longer to recuperate from his illnesses. Typically, he had his first asthma attack at age 2. He had to be homeschooled because the Arizona school he was going to had mold problems. You wouldn't think so, but I'm going to talk about mold because it's pervasive, even in Arizona where the humidity is quite low. The swamp coolers, the flat roofs, the temperature differentials. Anyway, he reacted. He started going backwards with the mold issues, and he's doing fabulously well these days. So there's his picture, and he looks a lot better than I do, I have to say. So I did some research when I started doing my book because I had plenty of time because I didn't have any patients anymore, and I lost $120,000 my first 5 years of taking insurance, which is one way the insurance companies control what doctors do. You don't get reimbursed if they don't like what you do. So these are all the low thyroid symptoms that my pain patients had, and believe me, there's plenty, and you can go over that later as well. So that was 162 charts I reviewed, and I got bored. And so there were 34 patients, or 32, no, 34 patients who were already taking thyroid. They had just as many or more symptoms than the patients who were on 100 to 200 micrograms of levothyroxine, Synthroid, Levoxyl, whatever the T4 is. And they were just as bad or worse than the patients who had no thyroid. So then I got in trouble. This was my teacher, Larry Sonkin's research. Basically all normal blood tests, protein-bound iodine was the first blood test that they swore by. I like the Dr. Rhoda Barnes wrote a book that's referenced in my books as well, and I'll talk about him later. But he said a lot of the doctors swore by the protein-bound iodine study, blood test, basically, while the rest of us swore at it. And it was proven not to work. So that was the first erroneous blood test. It started in 1940. It didn't be disproven until 1967. And then my teacher was still trying to do research showing at age 76 that the patients with normal blood tests needed thyroid. So therapeutic trials and their cholesterol would come way down, because cholesterol, I will tell you, is a symptom of low thyroid. And they would feel a whole lot better, just barely more than half the patients he treated. There's the reference. Everything I have is referenced, just like Dr. Barnes is referenced, just like Jerry Tennett's stuff is all referenced. So cholesterol and the basal metabolism, the cholesterol elevation and triglycerides were so sensitive that doctors suggested at the Leahy Clinic that they used serum cholesterol as a diagnostic test for low thyroid. Dr. Barnes checked cholesterol in all the patients for 25 years. Most of the younger patients had some adults have normal or below normal cholesterol and still be in dire need of thyroid. So that didn't work. But I can guarantee you, high cholesterol means you're low thyroid. So pig thyroid has been the standard of care, or had been, from 1891 until 1970, when the doctors were told to treat with synthetic, otherwise they'd lose their license. That's when the TSH was mandated. Dr. Barnes, let's see. So he tested his patients for cholesterol and triglycerides. 95% normalized. The 5% who did not normalize had no higher risk of heart attacks, because it's not the cholesterol, just like Dr. Levy said. Okay. So the 1888 report talked a lot about the low temperatures. So Dr. Barnes, the first generation Hertog, Eugene Cohen said low temperature is a common record, and even the most mild forms of low thyroid, hypothermia, is an almost invariable accompaniment of the slighter forms. So Dr. Barnes would study the basal metabolism and the basal temperatures on all of his patients, and he found the basal metabolism to be more accurate. The basal temperatures to be more accurate. He published a study in JAMA, basal temperature versus basal metabolism, in the AMA in 1942. Of course, there's no money in that either, so that went goodbye. And I looked for the references in the textbooks that diss the basal temperature. They have no references. They just say it's shown not to work. So increased susceptibility to infection is one of the hallmarks of low thyroid. Desiccated thyroid is proven to increase the immune increase immunity, and that's the reference Dr. Barnes published on that. And I can tell you a whole lot of folks come in with chronic infections, and after a year or two they don't have them anymore. So also every animal that they did a thyroidectomy on, even before they started treating people, had accelerated hardening of the arteries, and by giving the glandular thyroid, it would stop the accelerated hardening of the arteries. So Dr. Barnes was an MD, PhD endocrinologist. He became a PhD endocrinologist at the University of Chicago, 1930, MD, 1937, and did research on all sorts of folks' long-term studies after that. So desiccated thyroid prevents arteriosclerosis and heart attacks. So also there's the study on stopping the upper respiratory infections especially. So this is Dr. Barnes' heart attack study. He started private practice in 1937, and heart attacks went through the roof after World War II, and he thought he knew why they went through the roof. He traveled to Graz, Austria, where Queen Maria Theresa Marie Antoinette's mom dictated that everyone in Graz have an autopsy in the 1700s, and they've been doing the autopsies ever since. So Dr. Barnes went to Graz for 18 centuries. He found out there was an American medical association over there. So he went and studied 18 summers, 70,000 consecutive autopsies. The gold standard. So I still don't understand how doctors can dismiss it, but they do. And of course, it's because what they've been taught for so long is erroneous, and it's not my fault. So don't get mad at the messenger. So Dr. Barnes, after World War II, the heart attacks went right through the roof. The American Heart Association started the Framingham study. You'll have to read about that. I don't want to have time, but anyway, 5,000 healthy people in Framingham, Massachusetts, to try to figure out what was causing this huge explosion in heart attacks. Dr. Barnes knew his patients weren't having any, so he started a study 2 years after the Framingham study began. It was a 20-year study, and these are some of the findings. So, shucks, I can't read very well off that monitor. So these are the patients he treated for 20 years. He published his research in 1974 for the first time. 1,600 patients, basically. He had to be in the study for 2 years. Some were in for the whole 20 years. According to the Framingham study, he should have had 74 heart attacks according to the ages and risk factors. Let's see, there we go. So he should have had 72 heart attacks, according to the Framingham study, and he had 4. So over 90% reduction in heart attacks. So he published a book, 2 books, several books actually, that solved the riddle of heart attacks. Was first published in 1976, and all the research is there. And I have there's still a Broda Barnes Research Foundation, despite he died in the 1980s, in his 80s. So you can still get reprints of the heart attack, solve the riddle of heart attacks through his research study. The references are in my book and on this slide, on the slides. So all 4 patients, the dosages range from 2 grains. So pig thyroid is measured in milligrams. And back when gunpowder was being measured in grains, that's when they were using the pig thyroid. So the 60 milligrams, actually 65 milligrams, is 1 grain. So it's a glandular thyroid. It weighs a whole lot more than the compounded T4 and T3 I use a lot, which are micrograms. These are milligrams. And it's the pig thyroid that all of his patients got in the 20-year study. It's becoming harder and harder to treat the thyroid patients with pig thyroid because of all of our toxins and allergies and teeth and everything else. So there are only 4 patients who had heart attacks who were on the lowest dose, 2 grains. The dosages ranged from 2 grains to 5 grains. And I'm thinking these days that he had 1,600 patients. The Hertogs have had generations of patients. The average adult dose is 3 to 3.5 grains, and I have the equivalents of the compounded T4 and T3 there in my books. And so for 16 years now, it's been my ambition to get people on more than 2 grains. So the adults need more than 2 grains. Dr. Barnes thought if he'd given these 4 patients more thyroid, he wouldn't have had any heart attacks. Well, guess what? I had no heart attacks in my sick pain patients population for 15 years. 0 that I had more than 2 grains. So I had one fellow have a heart attack as I was finishing my book, and I wrote an addendum. He had 4 stents when he came to see me. He had been a crack addict. He was still smoking cigars, and he had all sorts of dental problems. And he had his heart attack in the hospital in the coronary care unit because he had enough time, thanks to being on a bunch of thyroid for a couple of years, that he had, you know, the, what do you call them, the other smaller arteries feeding his heart or whatever. So he did the TPA. He was off work for 2 weeks. and back to work. The only patient I've had a heart attack that was on more than 2 grains in 16 years. So that's a pretty good report. Okay, so more than 2 grains. So anybody that's an adult probably needs, some of the really skinny small people might only need 2.5. The adults typically need 3 to 3.5, which was the average in Dr. Barnes' long-term study. That's the Hertog average I'll show you later. Anybody over 200 pounds probably needs 3.5 or 4 grains. The 300 pounders need 5 or 6 grains. So you can almost treat these people on their weight. And if you have a lot of problems, don't keep increasing the thyroid. I can tell you that's not the right thing to do these days. So guess what? 30 patients who quit the study had fatal heart attacks within 6 years of stopping their thyroid. So that says something to his research as well. So he didn't attempt to control exercise, smoking, anything. He just gave them the thyroid. I attempt to control everything, by the way, because people are a whole lot sicker these days than they used to be, and they're harder and harder to treat. So these were the autopsies. Heart attacks, this is per 1,000. So, why isn't this? Well, there we go. So in 1930, heart attacks were causing, let's see, that's heart attacks, 1930. From 1930 to 1970, heart attacks went up, oh shucks. Let me see. Wish I could read these things better. Okay. So the change in heart attacks went from 6.8 per thousand in 1930 to 900, or went up over 90% to 69 per thousand between 1930 and 1970. So 6.8 to 69. Emphysema went from 8.6 to 40.6. So these are low thyroid illnesses. 8.6 to 40.6, that's a chronic infections, emphysema. So up 372%. The heart attacks went up 915%. The prostate cancer went from 1.8 to 8.3, so 361% increase. Cancer in children went up 349%, and lung cancer went up 400%. So deaths, guess what? Deaths from degenerative causes, so we're up 44%. But what was the change? The change was deaths from infections went down 56%. So let me go ahead and show you that that's why the heart attacks became pervasive. So tuberculosis was the #1 killer after smallpox was eradicated. And when they started, so in World War II, before they had the mass introduction of antibiotics, penicillin basically, which was first given to the soldiers in mass on the D-Day invasion. So the autopsies, the decline in heart attacks in Europe were attributed to decreased consumption of the animal foods. The autopsy showed that atherosclerosis actually doubled in severity in patients under the age of 50 from 1939 to 1945, so it wasn't the lack of good foods. Before people lived long enough to die of an infection, they were dying of tuberculosis. And that's in his book. So in 1939, 27 deaths per 100,000 of TB. That was before the war. So during the war, there were 55 deaths per 100,000 from TB. So lack of inadequate nutrition and animal fats decreased immunity during the war. Severe atherosclerosis was found in coronary arteries in those dying of tuberculosis, every single one of them. TB in the lungs of all those. So after the war, people started dying of heart attacks because they had had anti-tuberculin drugs and antibiotics. So TB was in the lungs of all those dying of heart attacks in 1947. So here's your Asia study. The Japanese weren't having heart attacks, according to the World Health Organization. And guess why? Because they had 169 deaths per 100,000, as opposed to 30 deaths per 100,000 in the US. So they were dying of tuberculosis. So this is from the American Geriatric Society. It is fitting that Dr. Barnes and Dr. Rotzenhofer was the pathologist that helped him do the 70,000 autopsy studies. So the quote I loved from that report, it is fitting that the TB sanatoriums of the past are being converted into the general hospitals for the management of heart attacks. The identical patients are arriving, being cared for, but they are arriving 25 years later with a new ailment. So that was in the Journal of Geriatrics. Oh, I forgot to read the darn disclaimer. So I do not have any financial interest of a product in my talk with any companies offering grant monies for this continuing dental and medical education program. So that's one reason I was having problems. It was partially blocked from that. So forgive me for being a klutz. Okay. So during World War II, Germany had a precipitous rise in tuberculosis during the war and a marked decline in heart attacks. Great Britain had a slight increase in TB and a slight decrease in heart attacks. Tuberculosis and infections did not increase in the US, thus the heart attacks did not decline. So penicillin, anti-tuberculin drugs were the answer. So he published The Solved Riddle of Heart Attacks in 1976, and that is nowhere to be found, even online. You can't find any of the old books. So you have to go through his research foundation and get a copy. So once again, he gave lots of thyroid from 2 to 5 grains. Only 4 people have heart attacks. 90% of predicted heart attacks from the Framingham study were prevented. Pre-existing hypertension resolved in 80% of the cases treated with desiccated thyroid. So the best treatment for hypertension is also thyroid, including the compounded T4 and T3. Reduced incidence of diabetes, he reported, and few complications in diabetic patients. I'll go over diabetes shortly. 90% of menstrual complications resolved, 90% of acne resolved, 90% reduction in migraines, and on and on and on and on. So the American Heart Association, so I'm going on to congestive heart failure. Sorry, I'm a little bit of a screw up, but here we go. So the American Heart Association estimates current cost of heart failure to be $31 billion per year and projected $160 billion by 2030. Over 5 million Americans suffer from congestive heart failure. More than 500,000 are being diagnosed yearly. So half the people die within 5 years, and it's a miserable death. I'm sure you're aware. So the first before treatment and after treatment pictures was by the the first endocrinology textbook author, which was Herman Zondek. So 1918, you can see the big heart silhouette. Although it might be a little more difficult, I've got much better pictures coming up next. So Dr. Zondek gave the patient's thyroid, shrunk the heart down to normal size. Okay, so this was a wonderful journal article that I found in the American Journal Association by Dr. Farr. So you can see how large the heart is. It takes up the whole silhouette of the chest. And for those who are unaware, the little lines are the ribs. This is the entire silhouette taking up the whole chest cavity of the heart. So the references is here. So this was 1923, October 24th. So 12 days later, the heart's beginning to shrink in size. So the basal metabolism was now, the initial basal metabolism rate was, where is that? Basal rate. It goes back here. October. So no, it's not. So Dr. Farr was at the University of Minnesota. That's a JAMA article that's referenced. So 12 days after beginning thyroid medication, the basal rate was now -10. So better, and it's starting to resolve. Appearance of the heart December 19th. The rate is now +3, the basal metabolism. The heart outline's been retouched in order to bring more clearly. So this is a normal size heart. So in 1923, they could keep the patients in the hospital as long as they wanted. So they discontinued the thyroid, and let the heart get big again. So 6 weeks later, the heart's enlarging, and they put the lady back on thyroid. It's now March of 1924. So 5 weeks after the second time, basal metabolism is normal. They shrunk the heart back to normal size. So I love this quote. So the shape of the heart in severe myxedema is so characteristic that the röntgenologist, back in the 20s, they weren't radiologists, they were röntgenologists, diagnosed the second and third cases in my series after examination of the x-ray by itself. So the heart that is greatly dilated in all the chambers is low thyroid. So this was the last before treatment and after treatment picture from Dr. Escamilla and Dr. Lisser. This woman had ascites, a belly full of fluid in her peritoneum. She had enlarged heart. She had a megacolon. You can see how big her colon is. The heart is enlarged. So Dr. Escamilla gave her 2 grains of thyroid to begin with, and then they increased it to 4 grains. So I love all these symptoms because they're so profound when it comes to low thyroid. She came in complaining of weakness, sore and stiff muscles, slowing to mental, stiff and sore joints, slowing to mental and physical activity, impairment of memory, slowing of speech, dryness of skin, lack of perspiration, cold intolerance, loss of eyebrow and body hair, constipation, heavy periods. So ascites and anemia, yellowish skin is called keratonemia, enlarged heart. The BMR was 41% below normal. So 3 months of regular old desiccated thyroid. Whoops, where's that picture? So it took 3 months. Oh, well, it was here. So you can see the fluid is mostly gone, if not all gone. The heart has normalized in size, and the colon is also normalized in size. So 1920s, we knew how to treat heart failure quite well. Unfortunately, that's gone. None of my patients have had any heart failure except for an 87-year-old lady. She had root canals and a mouthful of amalgams, and she wouldn't do anything about her teeth. And at 87, she was diagnosed with heart failure, my first patient. Okay, so they called this the Escamilla-Lisser syndrome, or internal myxedema. So that's what I was thinking I was doing. Because you don't have to be obese and have the puffiness. So, so you can also have tachycardia. I just threw this one in for extra, you can have variations, like you could be extremely skinny or extremely obese, or you can have a rapid heart rate. And the heart rate normalized after giving the thyroid. And you go very slowly in patients like that. It's also in one of Dr. Barnes' research studies. So you can see how puffy her face was. So prevention and treatment for diabetes is next. So once again, costs in the U.S. are about $245 billion a year for direct medical costs and $69 billion for reduced productivity. The American Dental Association, or rather the American Diabetic Association, estimates 25.8 million children and adults have pre-diabetes, have diabetes. 8.8% of the population. Pre-diabetes is 79 million. So I would say they were low thyroid, not pre-diabetic, or had the metabolism problem. Okay, so diabetic complications, leading cause of kidney failure, blindness, diabetic retinopathy, which may lead to vision loss. 60 to 70% have mild severe forms of nervous system damage. In 2006, 65,000 lower limb amputations in America. Basically, all the complications of diabetes happen to be accelerated hardening of the arteries. They don't have circulation, so all the complications are due to the hardening of the arteries. So let's see what happens. So within several months, Dr. Barnes had 42 diabetic patients that entered this 20-year study. They had low temperatures, were placed on thyroid. Within several months, they had fewer infections. Their wounds healed promptly. Cholesterol, triglycerides returned to normal. No gangrene, kidney failure, no stroke, no blindness, no neuropathies. Only one patient suffered a heart attack. So once again, well referenced. Dr. Barnes' autopsy study showed the rate of amputations in Graz, Austria, in the non-diabetic population in Graz was 5 times that of the diabetic population in the U.S. So it's thyroid. Thyroid, 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 thyroid. So here we go. So there's tapes you can listen to his lectures. They're amazing tapes. 3 hours of his lectures in Mexico, where he was lecturing in the 1970s. So you can get his copies of the tapes. They're amazing things to listen to. Okay. So he realized after a number of years that the vast majority of his patients weren't having any diabetic complications. He woke up one day and said, "You fool, you know, all your diabetic patients are defined." This is 20 years later. And so he started looking in the research, has anybody else ever reported this? And sure enough, the Journal of Michigan State Medical Society, 1954, vastly reduced incidence of diabetic complications as well as the elimination of the symptoms associated with low thyroid. And the thyroid hormones had no adverse effect upon diabetic control. So Dr. Eaton was the first, and Dr. Barnes found that research and published his own. So 4 adult patients of mine developed type 2 diabetes. 3 of these patients had not yet reached the therapeutic dosage. And once again, the adults need more than 2 grains. So I had 3 people, and they weren't too happy. They developed diabetes when I started treating them, but they were already developing it. I can guarantee you that before I started treating them. And the ones who were on more than 2 grains, I only had 1 patient on more than 2 grains that developed type 2 diabetes. He had rheumatoid arthritis and Hashimoto's, autoimmune diseases when he came to see me. He also had root canals and a mouthful of metal. And he still had his root canals when he developed full-blown type 2 diabetes. His blood sugar went to 250 or whatever. So he's the only diabetic patient I've been treating for 15, 16 years who developed type 2 diabetes. And, just like the guy who had the heart attack, he had a whole lot of pre-existing problems. All right. So, primary form of hypothyroidism effect of thyroid. Let's see. Oh, mitochondrial diseases are a primary form of hypothyroidism. There we go. So, I heard a lecture. Actually, it was my father. When I came back from New York, after being in New York for 2 years, I learned enough. My dad had been on thyroid for a decade or more, and the doctor told me he was going to have to take thyroid the rest of his life. And a year after they took away his thyroid, and I had no idea what I was doing back then. That was 1970s when my parents moved to Florida. They took away his thyroid. A year later, he had rheumatoid arthritis and suffered the rest of his life. Anyway, when I got back from New York, he was 80, and I knew that he needed his thyroid. I gave him thyroid and testosterone and DHEA. He had, my mom was scared to death. He had glassy eyes. He had, his sense of humor had gone. His mentation was going down the tubes. It was obvious that he had early dementia and was going down the tubes. So I knew he needed his thyroid and his testosterone by then. So I also gave him a little DHEA. Within 6 months, he was as bright as ever, and died 6 years later at 86 from a botched knee replacement surgery. And that was the first time I thought there was a connection between thyroid and dementia. And Dr. Barnes' tapes, he talks about how in his 20-year study, none of his patients, or all of his patients, were living into their 80s and 90s and had all their faculties intact. So that was a big sticker in my brain that I didn't forget as well. They had all their faculties intact, just like my dad regained his faculties. So I started researching mitochondria, and I'll show you what I came up with. So this was the lecture in 2000 in Las Vegas. As a matter of fact, Dr. De La Monte had run the Brown Research Award for that year's research on Alzheimer's disease. So what I'm going to talk about is thyroid, but it's also basically I'll show you why, and why I think thyroid and mitochondria are so integrally related. So this was what Dr. De La Monte said. The energy metabolism is decreased in the mitochondria. The amount of enzyme formation in these patients' mitochondria is also decreased. The number of mitochondria is decreased. Females are affected more than males. The development is much higher in developed nations with lower early death rates, like America. So, by the way, Dr. Barnes' research, his autopsies, the 3-year-olds who were dying had already evidence of atherosclerosis in his autopsy studies. So females are affected more than males. That's certainly the case with low thyroid. Incidence increases with age. That's low thyroid. So I started researching thyroid, and I went to the Guyton textbook. You know, that's what they taught us in med school. So here's what they said about thyroid. It seems almost to be an obvious deduction that the principal function of thyroxine, of course that's all they use, so a thyroid hormone, might be simply to increase the number and activity of mitochondria. So there's the reference for that. So main focus of lots of research is mitochondria. They're responsible for 90% of our body's energy production, just like the thyroid. Every cell in your body is hundreds of thousands of mitochondria, comprise a third of the heart weight, marked increase in size and number when you give the thyroid hormones. Patients' basal temperatures increase, as do their metabolism. Almost all of Dr. Barnes' study patients live in their 80s and 90s while their faculties intact. None of Dr. Starr's patients have developed any dementia or Alzheimer's. Current cost is $214 billion. It's expected to be over $1 trillion by 2050, and that's just America. And yes, it's epidemic, just like low thyroid. So I did research on the mitochondria, the tissues. This was the first research article I found. So the tissues and organs most affected by cellular energy declines are in order of their impact. The central nervous system is number 1 on mitochondrial diseases. It happens to be number 1 in thyroid as well. The brain needs a whole lot of energy, and you don't have enough when you're low thyroid. Heart and skeletal muscle suffers. Kidneys and hormone-producing tissues also suffer. That was the first report in the Scientific American by Dr. Wallace in 1997. So people born with mitochondrial DNA mutations often become ill only after a period of decades, and their conditions usually worsen over time. Thyroid. Patients born with inherited mitochondrial defects have symptoms that are more varied and less predictable than defects in nuclear genes. Thyroid. Mothers with more severe mitochondrial defects have more severely affected children. Thyroid. You see these obese moms with their obese myxedematous kids walking down the aisle. Common symptoms include heart failure, diabetes, kidney problems, diseases related to aging, Alzheimer's, neurological and muscular problems. Thyroid. So I threw this one in. The creatine phosphate is the shuttle between mitochondria and the myofibrils, the muscles. So the creatine phosphate delivers energy to the mitochondria from the myofibrils, where it is released for muscular contraction. Abnormal lack of creatine in the urine of adults with myxedema. Rapid reappearance in the urine when treated with thyroid. Abnormal increase in the urine excretion in thyroid toxicosis. So that was my teacher again, not one of Dr. Sonkin's papers that's referenced. Here's the clincher. And I just found it not that long ago. I take a big swallow. I haven't even contacted this wonderful doctor because I wanted to give this lecture first. Because I can tell you, nobody's wanted me to lecture about my research, even the alternative groups. So thank you, Dr. Fisher. And just like Wonder Bread, so Edward Friedman, he's a neurologist at the University of Chicago. Just like Wonder Bread helps build strong bodies 12 ways, says Dr. Edward Friedman in his book, The New Testosterone Treatment, How You and Your Doctor Can Fight Breast Cancer, Prostate Cancer, and Alzheimer's. Writes how bioidentical hormones help prevent Alzheimer's disease in 9 different ways. So 2 abnormalities common associated with Alzheimer's are beta amyloid plaques between neurons in the brain and neurofibrillary tangles within the neurons. The tangles are composed of hyperphosphorylated tau protein, which eventually kills the neuron. Impaired glucose metabolism in the brain, poor blood circulation to the brain are also associated with Alzheimer's, and the disease destroys brain function, ultimately fatal. Apolipoprotein E4 is a genetic mutation which hinders beta amyloid excretion from the brain. Vitamin D3 increases the excretion of beta amyloid from the brain. Beta amyloid secretion is impaired by both testosterone and estradiol. Cycling with progesterone also enhances this impairment of estradiol. Beta amyloid is a peptide created from 40 to 42 amino acids. An increased ratio of the 42 amino acids over the 40 is associated with Alzheimer's. This ratio is also decreased by testosterone. Alpha secretase is an enzyme, prevents production of beta amyloid. Both estradiol and testosterone increase alpha secretase activity. Beta secretase is an enzyme that increases the production of beta amyloid. The enzyme neuroprisylin degrades beta amyloid. Testosterone and estradiol increase the neprilypsin activity. The hyperphosphorylation of tau protein is inhibited by testosterone, but not by estradiol. However, progesterone also inhibits it. Both estradiol and testosterone improve brain cell glucose metabolism. The impaired blood flow to the brain is also demonstrated in Alzheimer's disease. It's also improved by both testosterone and estradiol. So now you know why my father recovered with his thyroid, testosterone, and DHEA and whatever. Anyway, so according to Dr. Friedman, the only real thing will work. The hormone receptor is everything, and only biological hormone structures will fit into the receptor correctly, given the evidence of remarkable interplay of hormones and the known problems associated with Alzheimer's and the lack of any other effective treatment developed thus far. Shouldn't we be keeping hormone levels optimal in the brain? Shouldn't it be a priority for us? How much more time do I have? Not much. Well, so B12 is also one of the culprits. There are 2 books now, one by Dr. David Brownstein, and the other one is Could It Be B12, an epidemic of misdiagnosis? So the blood tests don't work, according to the 2 books, and I agree completely. You have to give the patients the B12 because that causes a whole lot of dementia and problems, and you can see the risk of B12 deficiency. It's on the slides. You can look at it later. It's quite a number of drugs block B12. So Dr. Tennant, the last thing I want to talk about is voltage. So Dr. Tennant is a genius. His booth is outside at Synergy. Our body runs on millivolts, and thank goodness I met Dr. Tennant, because I don't think I'd be above ground had I not. I had all sorts of health problems. But anyway, so our body runs on millivolts, and if you want to read about how the body works, then read his books. His cancer book is coming out in about 1 month. He's already got he's figured out from the top of the head to the bottom of the feet how the body works and how its interplay is. He's got an atlas on how that works. We used to, as I said, we used to banter back and forth about thyroid versus voltage. He'd say voltage, I'd say thyroid. You can see why, because the thyroid does such wonderful stuff. But I'm going to show you some pictures. It's the last thing I'm going to do is show you these pictures, because I think it basically cements Dr. Tennant's research as well. And unfortunately, I had to be the one to do it. So once again, my health problems. So I had a surgery when I was 14, big surgery. I was an athlete back then, and I fractured ankle and torn ligaments. 1973, major surgery. So in 2008, Dr. David Derry, who wrote the Breast Cancer and Iodine book, described how iodine, Lugol's iodine, 5% was what he recommended, dissolved scar tissue. And by then I knew scars were bad, and I'd been with Dr. Tennant a little while. We didn't have the transducer back then, but we do now. We have easier ways to get rid of the energy blockage caused by scars. So anyway, I started treating my suture line, and the darn iodine will show you how big the subcutaneous scar is. Well, after, so here's how my ankle progressed. So this is March 2009. You can see that it's a whole lot bigger than just the suture line by now. And they just keep following, painting twice a day with 5% Lugol's. And by the way, the FDA is trying to suppress the Lugol's. Now it's 5% is prescription. I can only give patients 1 ounce because they say you're going to make methamphetamine, because that needs iodine crystals to make methamphetamine. So that's a good excuse for not allowing much iodine. So, so the darn scar went all the way around my foot. It just kept getting bigger and bigger and up into my calf and into my heel. And after a couple of years of treating the scar, because it was painful and I had to stop for a while and then start again and do it again, I thought, I was always in the bathroom doing it because I'd spill it every once in a while until I figured to put the little iodine bottle in a cup with some paper so it wouldn't, the Q-tip that I would use to paint it wouldn't fall over anymore. Anyway, I thought this other side said, oh, the skin doesn't look so good. Let me put a little iodine here. Well, guess what? I had a scar just as big on the other side with no surgery. So here are my feet. So one's the right foot and one's the left foot. And the darn scars blocked all the voltage in my body, all the acupuncture meridians, I mean, because my feet turned into fungus balls 12 years ago, and I didn't know why. And I had all sorts of other problems with my feet since there was no voltage going to my feet. And it's taken me 12 years to have healthy feet again. And it's all about the voltage. So 2 years ago at the Top 20 Alternative Doctors Conference, I told Dr. Tennant I had capitulated. It is all about the voltage. And if you don't know, Dr. Tennant lectured last year, and I had a 3rd-degree burn on my hand. My propane gas tank caught on fire while I was barbecuing, and it was shooting flames out the valve. And the dumb doctor tried to, that's myself, thought if I tightened the valve that I might stop it from blowing me up. Well, after 2 tries, I had a 3rd-degree burn on my thumb and the webbing of my hand, and I gave up and called the fire department. They said, well, no, it wouldn't have blown up anyway. Let's go to the hospital. I said, no, thanks. I'm going to try to treat it. So it's on my website. It's on Dr. Tennant's website. I healed this 3rd-degree burn in 11 days without any pain pills. Why? How could I do that? Because I put voltage in the other hand, a 3-inch round pack, because that's how the body works. Dr. Tennett's figured out how the body works. Right and left-sided acupuncture meridians he calls biomeridians. And unfortunately, by having this one blocked for decades and decades, Dr. Tennant has also figured out that the battery packs, the rechargeable battery packs, our muscles are piezoelectric. So that's how we recharge our batteries. So I was getting no voltage. Guess which muscles are in charge of your brain? The feet. My feet had no voltage. They couldn't get through the scar tissue and all the fungus and everything else that was wrong with my feet. So my mentation has been going down for a couple of years or more. And thank goodness I got rid of my scars when I did, because I was able to barely squeeze through, still practicing medicine and not having a memory. And I got rid of the scars just in the nick of time. That Dr. Tennant also teaches that it takes 11 months to replace all the damaged cells in the brain. And I'm about month 8 now from being out of the scars. So I'm about 80%. So I get mixed up easily, and I'm still not quite 100%. So guess who? The only patient in 16 years who had mild dementia in my group. I can tell you it's an awful disease. I couldn't figure out what keys to put into my car. Didn't have enough brain power to take the keys I didn't need off. So for months and months, it took me a while to get into my house and to start my car. And luckily I have just one sheet of paper on both sides. It's basically how I treat patients. It's very repetitious. It's not that hard. Although I should tell you, Dr. Ray taught me about mold, because the hardest patients to treat are the ones with mold. They typically have bright red or beet red nares. They don't know they have chronic mold exposure, but they usually wake up stuffy. It's caused by low T cells and low gamma globulin. You get masking, and the patients do a lot better on a little tiny dose of thyroid. But when you try to increase the dosage, they get palpitations and tremors and just do terribly, and it's just a nightmare. And I've got a little thing I'm adding on to my treatment when people come to see me from now on. If I diagnose them with some mold allergies, I will give them one try to crank up their thyroid. And if it doesn't work, which is 90% of the patients with severe mold allergies, then they have to go to the environmental health center and get their mold allergy treatment with Dr. Ray, or we have one of the best clinics in Phoenix also, does provocative neutralization. You can get rid of the mold spores, but I don't think you can get rid of the allergies doing all sorts of other things. You'd have to get the allergies treated. I know, because I had to move out of a condo in Atlanta because I was poisoned with mold. I was mildly chemically sensitive. I rented a house and it had mold in it, so I've been treated twice for the molds. So I have all sorts of firsthand experience, and I feel better than ever, and I can't wait to get my entire brain back. So I'm sorry I fumbled so much and finally figured out what worked. And I'm really, really happy I was able to give this talk to you all. Thank you so much.